Here are some ancient yoga techniques to cure hiatal hernia. A hiatal hernia is a type of hernia in which the upper portion of the stomach moves up through the diaphragm and into the chest region. The diaphragm contracts continually as you breathe in and out. It lies between your abdomen and chest. Today we are going to discuss how yoga breathing techniques or pranayama can help in reducing the severe consequences of hiatal hernia. According to research on yoga, it has been indicated that breathing exercises have therapeutic effectiveness. The ancient yoga philosophy considers breathing a fundamental tool to enhance one's well-being and treat numerous diseases. There are certain yoga breathing techniques that can be helpful in the aid of hiatal hernia. Kapalbhati is good breathing pranayama for most of the diseases it cures very well, but in hiatal hernia, Kapalbhati should be done in a different way. Normally, we push and pull our stomach or expand and contract our stomach fast and vigorously, which is beneficial for the body, but in hiatal hernia it would be risky for you to strain on your stomach or thoracic region, so for the right technique just sit in a comfortable pose, adopt Sukhasana, Padmasana, Urdhva Padmasana, Dharana, or on the chair. Just as Kapalbhati pranayama, take breath in through your nose slowly, do not expand your chest and stomach too much outside, and then continuously breath out with a very short and steady breathing exhalation. Remember, do not take out your breath vigorously and keep your abdominal muscles relaxed. Very short expand and contraction is acceptable. You can place your hand on the middle abdominal area or tie a cloth on the stomach to stop movement in the stomach. Read 8 Reasons Why You Should Do Yoga Every Day. Ujjayi Pranayama. In Ujjayi Pranayama, sit in a comfortable posture and keep inhaling and exhaling slowly through the nose. Usually, in Ujjayi Pranayama, breathing technique should be fast to raise metabolism and heat in the body, and strong and fast movement in chest and abdomen, but in hiatal hernia, the slow and steady movement gives you therapeutic results. Within 3 to 6 months you can cure yourself of the hiatal hernia. Abdominal deep breathing. Read International Yoga Day 2019, Yoga Asanas for Asthma Patients to Lose Weight. This is a foundation of breathing practice for pranayama. In abdominal deep breathing, your focus should be on the movement of the stomach in and out. Do this by sitting in any posture like Padmasana, Urdhva Padmasana, Vajrasana, or you can also adopt Shavasana. Do not overstretch the stomach out and in.